Did you know your body could be sending you subtle signals up to a month before a heart attack? That's right, your heart might be trying to warn you, but are you paying attention to the signs? In today's video, we're uncovering 8 shocking red flags that could be your body's way of telling you something seriously wrong. And it might just save your life. Keep watching, because this info is more important than you think. 1. Unusual fatigue or exhaustion. One of the most common signs that can appear up to a month before a heart attack is an unexplained, overwhelming sense of fatigue. This symptom often presents itself as a sudden or gradual feeling of being excessively tired despite adequate rest. It may feel like a struggle to go about daily activities that were once easy, such as walking, climbing stairs, or even getting out of bed. This unusual fatigue may not improve with rest and may feel more intense than the typical tiredness people experience from a busy day or a lack of sleep. Research suggests that fatigue can be a result of the body trying to compensate for the heart's inability to pump blood efficiently. The heart, when stressed or weakened by a blockage, cannot deliver sufficient oxygen to vital organs and muscles, causing the body to feel drained. In fact, the American Heart Association highlights that fatigue is often reported by women in particular as a significant pre-heart attack symptom. The body's demand for energy may cause people to feel drained, and often, this symptom is dismissed as stress, poor sleep, or aging. However, if the fatigue persists or is unusually intense, it could signal an underlying heart issue that needs immediate attention. 2. Chest pain or discomfort. Chest pain is perhaps the most well-known symptom of a heart attack. However, it's important to note that chest pain or discomfort may start as a warning sign up to a month before the actual heart attack. The pain may not always be sharp or intense. Instead, it could feel like a heaviness, pressure, tightness, or a mild aching sensation in the chest. It may come and go, often worsening with physical activity or stress, and can be easily overlooked as indigestion or anxiety. Some people describe the discomfort as if someone is sitting on their chest or applying pressure to it. This type of pain or discomfort is due to a decrease in blood flow to the heart, which causes the heart muscles to become oxygen deprived. This can happen when the coronary arteries begin to narrow due to plaque buildup, a condition known as atherosclerosis. A gradual decrease in blood flow often leads to discomfort, which can be mistaken for other non-cardiac issues. The chest pain may be accompanied by pain radiating to the left arm, neck, jaw, or back, and it is essential to be aware of these symptoms, as they can signal a potential blockage in the arteries. 3. Shortness of breath. Shortness of breath is another red flag that may appear up to a month before a heart attack. The feeling of breathlessness may occur unexpectedly, especially during physical exertion or even while performing simple tasks that didn't previously cause difficulty. This symptom is often caused by the heart's reduced ability to pump blood effectively, leading to fluid buildup in the lungs, a condition known as pulmonary edema. As the heart struggles to pump blood, the lungs become congested, and fluid starts to accumulate, making it harder to breathe. People who experience shortness of breath may feel as though they can't catch their breath or that they are suffocating. This is particularly alarming when it occurs during periods of rest or low activity, which can indicate that the body is under significant stress. It's important to take any unexplained shortness of breath seriously, especially when it is accompanied by other symptoms such as chest discomfort or fatigue, as it can be a precursor to a heart attack. For dizziness or lightheadedness, dizziness and lightheadedness are also red flags that may signal an impending heart attack. These symptoms can be linked to a decrease in blood flow to the brain due to narrowed or blocked arteries. When the heart is not pumping efficiently, it cannot deliver enough oxygenated blood to vital organs, including the brain. This can result in feelings of dizziness, vertigo, or even fainting. It's important to distinguish between mild dizziness due to dehydration, sudden movement, or changes in posture, and persistent dizziness that occurs without an obvious cause. If dizziness persists, particularly if it is accompanied by other symptoms like chest pain, nausea, or shortness of breath, it should not be ignored. People who experience dizziness or lightheadedness should seek medical attention promptly to rule out any underlying heart issues. 5. Swelling in the legs, ankles, or feet. Swelling in the legs, ankles, or feet is a symptom that may emerge weeks before a heart attack. This condition, also known as edema, occurs when the heart is no longer able to pump blood effectively, causing blood to pool in the lower extremities. As blood flow becomes sluggish, fluid leaks from the blood vessels into surrounding tissues, leading to swelling. In severe cases, this swelling can become noticeable in the abdomen or arms as well. This swelling may be accompanied by a feeling of heaviness or tightness in the affected area, and it may worsen as the day progresses or after prolonged periods of standing. Swelling can also cause discomfort, making it difficult to walk or wear certain shoes. While it's normal to experience some degree of swelling after standing for long periods, persistent or unexplained swelling, especially in combination with other symptoms like chest discomfort or shortness of breath, should be evaluated by a healthcare provider to rule out any heart-related issues. 6. Nausea, indigestion, or stomach pain. Gastrointestinal symptoms such as nausea, indigestion, or stomach pain are commonly overlooked as heart attack warning signs, but they can be significant red flags. Many people, especially women, report experiencing stomach discomfort or nausea weeks before experiencing a heart attack. This is because the heart and digestive system are both controlled by the autonomic nervous system, and stress on the heart can cause disruptions in digestion. The discomfort may be mistaken for typical digestive issues, such as acid reflux, heartburn, or a stomach bug, but if these symptoms are persistent or unusual, it's crucial to consider the possibility of a heart attack. Nausea and stomach pain are also linked to the body's response to reduced blood flow to the stomach and intestines. As blood is redirected to vital organs, such as the heart and brain, the digestive system may suffer, causing discomfort, bloating, or nausea. Women are particularly prone to experiencing gastrointestinal symptoms as part of their heart attack warning signs. These symptoms may be accompanied by other signs like fatigue, shortness of breath, or dizziness, and when they occur together, it may indicate that medical attention is necessary. 7. Cold sweats or sudden sweating. An unusual occurrence of cold sweats or excessive sweating, particularly without physical exertion, can be an alarming sign that the body is under distress due to a potential heart problem. This may include breaking into a cold sweat at rest, even when the temperature around you is normal. Cold sweats happen when the body is trying to compensate for decreased circulation or a lack of oxygen in the bloodstream, which may occur in the lead-up to a heart attack. The body's response to heart strain is often one of panic, and as the heart struggles to maintain normal function, the sympathetic nervous system becomes activated, triggering sweating. For many individuals, especially women, this can be one of the earliest signs of a potential heart issue. Along with other symptoms, such as chest pain or discomfort, dizziness, or nausea, cold sweats should not be ignored. If the sweating persists, is unexplained, or accompanies other red flags, it's crucial to seek immediate medical attention. 8. Sleep disturbances or insomnia. Another often overlooked sign that may appear up to a month before a heart attack is trouble sleeping, including insomnia or disturbed sleep patterns. People who are at risk of a heart attack may experience difficulty falling asleep, staying asleep, or even waking up feeling unrefreshed despite a full night's rest. Heart disease and sleep disturbances are often linked due to the body's heightened stress levels, hormonal changes, and the strain on the cardiovascular system. The American Heart Association recognizes that poor sleep can exacerbate heart-related issues, as lack of sleep may contribute to increased blood pressure, inflammation, and higher levels of stress hormones, all of which can affect heart health. Moreover, disturbed sleep could be a direct result of the body's inability to maintain proper circulation during the night. If sleep problems persist and are accompanied by other signs, such as fatigue, shortness of breath, or chest pain, it may be an indication that the heart is under duress. Individuals experiencing persistent sleep disturbances should discuss this symptom with their healthcare provider, especially if they also have a family history of heart disease or other risk factors.